Hi, so my name is Rachel Halford. I am the CEO of the Hepatitis C Trust. I'm the regional European board member for the World Hepatitis Alliance, and I'm a board member for Liver Patient International. But I'm here today to talk to you about COVID-19 and the impact on the Hepatitis C Trust. So I'm just going to give you a little introduction on who we are, the Hepatitis C Trust. If my slides will move, quick click. So here we are. So we are the national UK charity for hepatitis C, and we're a patient-led and patient-run organisation dedicated to making a difference to people affected by hepatitis C by providing up-to-date information, advocacy and support to enable them to meet their hepatitis C and health-related needs. We also educate the public and policy makers about hepatitis C with the aim to improve patient care, education, diagnosis, treatment within the NHS. And we have one mission, and our mission is to see the elimination of hepatitis C as a serious public health issue by 2030, and quite uniquely, to close as a charity because we will no longer be needed. So our services are delivered by a staff team of 60, well, in fact, a few more than that now as we're recruiting, 60 peer staff and 100 volunteers that operate across the UK. We have a few key areas of service delivery. So we have our national helplines. We have one for the community and one in the prisons. We have a national community peer programme, which I'll talk to you a bit more about later. We have a national peer programme, national training and volunteer programme, and we do some policy and parliamentary work across the devolved nations, and the devolved nations being Scotland, Wales and Northern Ireland. So I'm just going to move on and talk a little bit about how we work and the people we work with. So how we work, quite simply, peers. So as I said in the beginning, we're a patient-led and patient-run organisation. So the core of our services and the work that we do are delivered by peers, people who've had lived experience. And why do we use them and how do they work? Well, I guess because peers share their life experience. They offer an identification that no one else can offer to engage people, particularly marginalised groups that we work with. And they build up very easily trust. So the key groups of people that we work with, so we work with anybody that's affected by hepatitis C, but the core group, as we all know, with the highest prevalence are people who inject drugs. And we work with people who inject drugs, and that cuts across the homeless people and people affected by criminal justice system. And that, so for us, when we say criminal justice system, we work with people in prison, but we also work with people who are in probation services, probation hostels, etc. We work with MSM, sex workers, people infected by infected blood and blood products, a smaller group that often gets forgotten, but actually a really important group also, and migrants, including the South Asian communities. So I'm going to talk a little bit in a minute about the impact of COVID, but just to give you a slight overview. So, you know, I'm here really to talk about how our services have been impacted by COVID, you know, and how we've managed to work within. But this is about testing, you know, and prior to COVID, you know, we operated testing initiatives and worked alongside testing initiatives in really quite large numbers, both in the community, in drug services, but also in the prisons in terms of whole prison hits. So we're part of a national program that goes in and tests whole prison populations. So the numbers of people that were being tested prior to COVID was really quite large in the UK. We have an elimination deal, and there's a really big push to test and find people. The impact of COVID has been enormous, you know, and I don't want to paint a grey picture, but you know, it's an extraordinary environment that none of us have experienced before, but testing has been impacted on. So I'm just going to give you a little overview of what happened for us as an organisation. Yeah, and I think first of all, it's really important to say, you know, that, you know, before we talk about our services, being able to deliver our services as a small charity, it did mean that we had to put a lot of things in place to make sure that our staff, our volunteers were all safe, and that we were working with parameters that could lessen any of the risks that would from COVID that would impact on our staff. So what this meant was that we had to pull together policies and operational procedures, risk assessments. We had to make sure that we had comprehensive and really effective PPE, personal protection equipment. And within that, these were areas. This is an unknown, as I've just said, it's an unknown territory. So this was really kind of like pulling together robust policies and procedures that would support our organisation throughout and hopefully coming out the other side of the pandemic. We also had to think about how we were going to support our staff, our volunteers, and the patients that we were supporting. So one of the first things that we did alongside this was that we produced a couple of pieces of literature. We realised that there wasn't a lot of information, easily accessible information around coronavirus, or COVID as we call it. So we did 7 top tips. And the reason why we did this quite quickly was, a lot of our service users, the people who access our services, they're marginalised groups, lower literacy levels, and it was really important that we got out information that people could understand, basic information about how to protect yourself from coronavirus. So we did the one generic one for the general public, but then we also created one around for people who use drugs. I think it's really important. It cannot be underestimated, the impact that COVID has had on this particular group. One of the things that was highlighted really on was that, COVID, the symptoms of COVID are quite similar to, or could be perceived for someone who's using drugs, quite similar to withdrawing from drugs. So there's a real risk here that someone would think that they were withdrawing from drugs or withdrawing from heroin, when actually it was coronavirus that they had. So getting this information out there was really important for us. Moving forward, the impact of COVID, I've just done there's a little overview, testing. As I said in the beginning, we cannot underestimate the impact, that COVID has had on testing. It is huge. Primarily, at the core of the testing in the UK is done through drug services, harm reduction services, access to these, to harm reduction services, to needle and syringe programs, really limited. The impact was also seen on hepatitis C medications and on prisons. And just kind of starting from the bottom up with prisons, prisons in the UK went into what we call gold command, which meant they went on a complete lockdown. So no one was allowed in, no one was allowed out. 23-hour lockdown for people who were in there. And what this meant was that there was a reduction in testing, treatment, and, I kind of want to say, more importantly, the impact on the individual in this restricted environment with no visits from outside, etc. We did see, in terms of hepatitis C medicines, there was a bit of capacity. There were some hospitals that were able to still deliver or dispense medication for people they knew that were positive, but it was limited. In terms of access to harm reduction, so needle and syringe programs or OST, really limited. And kind of one of the consequences we saw off the back of this was that there was an increase in illicit drug use, a higher risk of reinfection, and as I said earlier, we've got news that's coming from America now, New York, particularly overdoses. And then testing, the closure of the drug services, they didn't necessarily close completely, but they reduced their services down to a very basic service. And what this has meant is, I've actually put lack of testing here, but by and large, it was no testing at all. And a consequence of that, as I've just said, reinfection, and of course, the undiagnosed hepatitis C. And then just to add in here in terms of testing, that if anybody had been able to do any testing, all of the labs were completely overrun with COVID. So in terms of testing, we really did hit a brick wall. So moving on to my next slide, lockdown activities. So this really is just as soon as COVID hit in March, for us it hit in the end of March. It happens for different people across Europe. It would have been totally different times for everybody else. One of the first things for us, once we put our policies and processes in procedure or alongside, our biggest concern was about, the people that work for us, the people that work with us, the people that we support. So, you know, telephone contact became crucial. We sourced phones for our volunteers and our peers. We begged, borrowed and stolen phones, stole phones. But we kept in contact with our patients, with the people we were supporting, with our volunteers, with our partners, really important as well, to find out what was going on for them, the clinicians, the nurses. We stepped up the opening hours of our helplines and our prison helpline. We actually started running that for 7 days a week, 12 hours a day. Really important in the climate, particularly that they were well shut down in. In terms of medication, our peers stepped up. A lot of the hospitals local to us, particularly in London, we saw nurses and clinicians deployed over to COVID, so consequently there was a real shortage of staff. We also saw or heard, you know, patients really concerned about leaving their homes because of their concern about catching COVID. So we were able to our peers were able to support and actually go to the pharmacies, pick up the medications, deliver them to patients. We also supported slightly further some of our peers and volunteers and patients in terms of food packages. You know, a lot of the people we work with, they make their money out on the streets begging or whatever. I don't want to steal, whatever. And actually, this was a really difficult time for them too. So we provided them with food parcels just to make sure that they were safe. And then in terms of our peers, what we did was, in fact, for our whole staff team, everything went over to Zoom. We had lots of training, we had lots of support groups, we had daily check-ins, we also did meditations, we provided kind of training for our staff team. But then what we did was, for all our peers and volunteers, we set up a whole day. They were welcome to join any day, but we did set up a whole day that was just for them, and that was Fridays, and they had a whole day of training. And then moving to the outreach. So across the UK, and I have heard that this happened across Europe as well, and in a lot of other countries, many of the homeless people, people that are living on the streets, were housed in hotels and hostels. And what this did for them as individuals, how incredible, it offered them, you know, warmth and shelter and safety. But for us as service providers, it offered us a unique opportunity to offer them support in terms of their health, their substance misuse, mental health, whatever, because it just offered this opportunity to engage with them. And very quickly, we got together with a group of other organisations, including clinicians and other providers, to come up with a whole testing hostels or hotels initiative. And this was incredible because, you know, we all know quite often when we work in partnership, you know, it takes a long time for things to happen. Sometimes egos get involved. And actually, this was incredible because there were no egos. It happened really quickly. We got together as a group and we set up these one-stop shops whereby teams would go into the hostels and the hotels and test people for BBVs. That's hepatitis C, hepatitis B, and HIV. Incredible initiative. And it was the beginning of a really enormous piece of outreach across the country in the UK, something that started in London. So I'm just going to show you this slide, which is, this was just the first 6 weeks that we worked in. So we supported the whole teams in terms of the actual hotel testing events or hostel testing events. And during those first 6 weeks, we supported in 46 hotels, 516 people were tested, and we found 41 HCV antibody positive. There were 6 HIV positive, 2 HBV positive. Out of the hepatitis C, there were 24 PCR positive and 11 started treatment on the same day, which, to be quite honest, I just think is incredible. Whilst these numbers were perhaps lower than we had thought, the fact that we could treat people on the same day because we were using CEPID, point of care testing, and we were able to return the results around really quickly was incredible. I think what we've learned as we've moved forward is that the testing that was done in London, it kind of, you know, one of the benefits from it was that it's identified that perhaps, that we had perhaps treated a lot more people in London than we thought we had, because the percentage was really quite low. Because as these initiatives were run out further across the country, we had a much higher prevalence of hepatitis C in the cohorts of people that were being tested. So looking at today and where we're at today, and this is kind of, we've been opened up, not opened up, that sounds quite strange, but, the country opened up after our initial lockdown. Things began to come back, to get back to normal. A lot of our staff that had been had to shelter because they had high, risks, etc. Everyone managed to get back to work. So really, I just wanted to give you a little overview of where we're at now. So our outreach services are working really well. Testing, so we ourselves and our peers deliver antibody tests. We have been delivering a few. There has been some testing with Halford, so point of care testing. We've been able to offer one-to-one support. We know that there's a pharmacy testing program that's about to start, and that's been great. So that's kind of in the community and things that are beginning to start. In the prisons, we have got access to prisons now. They've all begun to open. However, if there's an outbreak in the prison, of course, it closes down again. Currently, we work in 111 prisons and 43 have got COVID outbreaks, so they are shut down. But we do have access. We managed to gain the status as an essential worker within the prisons, which meant that we can go in and do health work with the prison teams, which is fantastic. We do have whole prison testing events booked in again, and they will be happening over the next, before Christmas, so over the next 6 weeks. And that really is irrespective of the fact that we are still in a lockdown. So that's quite a huge move forward. We operate a national BBV policy in the UK. And what that means is that people going into prison should be and are tested for all BBVs and sexual health diseases. So they are tested for hepatitis B, HIV, and hepatitis C. And the percentage of people tested during the COVID and up until quite recently had gone from a really reasonable kind of relatively high rate down to about 23%. Just recently, we've realized that it has started to come back up. We're back up to about 44%. So this is really good in terms of testing that, there are, a small percentage, albeit, but there are people being tested going into prisons. We will be testing people in whole prison testing programs as well. And we are able to offer one-to-one support. Treatment, is readily available for everybody. And I think that will continue, even though we're in another lockdown. And then testing. So, I'm with a heavy heart that I have to say that testing is nowhere near where it needs to be. It is a really serious concern, because drug services are not in a position to be offering the same kind of testing that they were offering before. However, in saying this, there have been some new initiatives that have been brought together. Postal testing has been launched, and online access to postal testing. That's come through one of our drug services. We have our peers testing, but as I said before, that's just the antibody testing. We have pharmacy testing coming on board. It hasn't quite started yet, but it's about to start. And then we have our outreach projects. So we, at the Hepatitis C Trust, we have an outreach van. There's a Halford machine on that. There are other outreach vans. So these outreach vans become like one-stop health shops, and they can test. And whilst they are a fantastic alternative, they're not, testing an enormous amount of people because they can't. They're a small one-stop shop, so they can't. But they are a source of testing that's happening at the moment. So just to kind of give you an overview of where we have ended up in terms of what we've been able to do from that initial lockdown to where we are today. This slide just gives you a little overview of the activity that we've been able to do in the community. I haven't put any information around the prisons because that was very different. The support that we were able to provide in prisons was more around creating videos, newsletters, etc. We weren't able to do any testing or case finding. However, in the community, what you can see from this sheet is, so we have lots of different databases, but we have one particular database, which is where we support individual clients who have tested positive for hepatitis C. So since the 17th of March till, in fact, yesterday or the day before, we have actually found 1,220 people who are hepatitis C positive. So these are people who are engaged with our peer program. We actually call this one the Follow Me program, which is where peers often say to the patients, follow me and I'll support you into treatment. And we follow them and we support them through the whole of the care pathway. Of these 1,220 people, 991 have got a HCV PCR positive. 690, I need to improve my glasses, have actually started treatment, which is incredible when you think about this, extremely restricted environment. And then there's another figure on here, and I just wanted to highlight the amount of work, that our peer workers have, that they do. So, irrespective of lockdown, and that goes right back to my earlier slide when I was talking about the telephone, being on the phone, is that there's a lot of interventions to work with and support people through the care pathways, particularly when you're talking about people who are really marginalised, very chaotic. So throughout this time period, we have completed 12,233 interventions. To, and what that shows you is the amount of interventions that this 1,220 people have received to get them through to, kind of the next stage within their hepatitis C treatment. So I guess, the positive from this is that there are people receiving a lot of interventions, people who need interventions. People are being tested. It's far less. And the ones that are on here, they would have come from the testing that has been done in the hotels, the hostel, a bit of testing outside of that, but predominantly, I would say, more than half has come through the testing programs across the country. And I'm just going to move on to my final slide here. So moving forward, concerns. I mean, this is the you can't even say the elephant in the room, because it's really huge. Our biggest concern is testing, and I was sat in a meeting just now, and for all of us, whether that's clinicians, whether it's people in drug services, whether it's us as patients or patient support providers, it's all of us with the goal to elimination hepatitis C, all of us who are worried about people's health. Testing is really important. And right here and now, it's not about to return to anything like it was previously. I think that another concern within, moving forward are the spikes in COVID. We don't know, we hear news of vaccines, etc. But, here we are in the UK. I know other countries across Europe are in lockdowns as well. There are spikes, continuing spikes, and it's ever changing. So, this isn't about to stop. There's hope, there's vaccines around the corner. But, for a minute, it isn't about to change, and we aren't going to see testing going back to what it was before. And I guess the other side of it is, when we talk about testing is, with COVID and spikes in COVID, there's an impact on the labs. There's an impact on the resources within the lab, can they cope with the load, but also shortages of reagents, because there is so much for the COVID testing. In saying this, though, it's really important to look at the opportunities. And for, I think that, here in the UK, we have an elimination deal. And I think what comes with that elimination deal is NHS commitment, innovation and action, and that's incredible. And I think that we're really fortunate to have that. So then what I mean by that is that there's a real push and there's backing within that push. We have got our outreach model. We're looking at expansion of mobile health vans across the UK. And I guess that, the innovation, we as voluntary organisations, crisis even, leads all of us to have to be creative. And what COVID has taught us is that, care pathways can be shorter. We can change. We don't have to perhaps we've learned we probably don't have to do as much as we needed to do in terms of the hepatitis C pathway. And there's much more of a role for peers to play. Peers, across the UK play a really large role within the Hep C elimination and testing. And COVID has taught us that, that peers can do more testing, peers can support with a delivery of medication. We have new initiatives coming online with the pharmacies. That's great. We've got the postal tests. They are, and at the moment they're quite new. We will have to wait and see how effective, but at least we have got some kind of initiative that's out there. We've also got the point of care testing, and we will be across the country. I know NHS England is increasing that resource. So there is hope within it. It's just that, I guess it's with a heavy heart that I say it, is that, there is no magic answer at the moment. There's a lot that we can do to support the people who are affected, to engage them, to do bits and pieces, to do a minimum. I guess that is my message within that, is we may not be able to get testing to where it is, but it doesn't mean to say that we need to stop trying, and it doesn't mean to say that we stop doing what we're doing and being creative and being innovative. If we want to reach elimination, we need to find the people who are affected, and whether that's elimination of hepatitis C, whether it's about HIV or hepatitis B, it's so important that we find other alternative methods of testing. And I guess my final bit on the end about the opportunities that have came from this, for me, it's been about the partnerships. I think it's been absolutely incredible, the partnerships that we've seen here and the way in which people have come together. I think that by nature, human beings probably become their worst and their best during crisis. As I said in the beginning, these are extraordinary times. We have never experienced anything like this. But in saying that, we know from experience that things move on, things change. We will all come out the other side, and we'll come out the other side with a lot of incredible learning. And I do hope that there's been something, even if it's just a little something, that's been useful within my presentation. Thank you very much. Goodbye.